The Rhode Island Standard of Need, or RISN, calculates a basic needs budget for two different family configurations in a single adult. It also shows how work support programs can help close the gap between earnings and expenses when earnings are not enough. Here are some of the key findings of the 2018 Rhode Island Standard of Need. Raising a family in Rhode Island is expensive. It costs a single-parent family $55,000 and a two-parent family $60,300 to raise a toddler and a school-aged child. It costs a single adult $21,800 to meet his or her basic needs. Many Rhode Island families do not earn enough to make ends meet. To meet these expenses, households need gross earnings of between $6,000 and $7,000 over expenses in order to account for taxes. Far too many households do not earn enough to meet their basic needs. In fact, 67% of single-parent families with two or more children don't make the $62,800 they need. 28% of two-parent households with two or more children don't make the $68,000 they need, and 43% of single adults don't make the $27,000 to meet their basic needs. RISN calculations highlight the inadequacy of the federal poverty level as a measure of economic security. The annual Census Bureau report documenting the number of Americans living in poverty undercounts the number of families struggling to make ends meet. Working families with young children need income over 2.5 times the federal poverty level to meet their basic needs in Rhode Island. Government-funded work support programs help close the gap between income and expenses for many working families. Child care subsidies, tax credits, and SNAP benefits help families make ends meet when wages are not enough. Subsidized health insurance through Medicaid and HealthSource of Rhode Island provide coverage for Rhode Islanders who do not have coverage through their job. Without subsidies from the Child Care Assistance Program, working families have a large gap between income and expenses for basic needs. The Child Care Assistance Program only provides subsidies for families earning less than 180% of the federal poverty level, or $37,400 for a family of 3. A parent earning just over that amount would need to pay $1,500 a month for regulated care for her children, and even with SNAP, WIC, and subsidized health care, their parents' monthly budget would be over $700 in the red. Increasing the Rhode Island minimum wage would close the gap between earnings and risen expenses, especially for single adults. Rhode Island's minimum wage of $10.50 an hour as of January 1, 2019, is not enough for a single adult to meet his basic expenses. The RISN shows a single adult needs at least $13 an hour to meet expenses, and that minimum wage workers with families need much more. Finally, the RISN shows that the income support provided by the Supplemental Security Income and the Rhode Island Works program leave recipients, the majority of whom are children and people with disabilities, without the resources they need to meet the expenses.